I'll try to keep it short and simple because I know I get a little bit too into the minutia.
You're perfect, Paige.
Also, I-20 westbound, just east of the downtown connector, still clearing up an earlier crash there. And in Hall County on I-985 northbound at exit 12, Spout Springs Road, we've got reports of an injury crash working there. This report is brought to you by Sprint. There are lots of different families, but only one family plan that's perfect for everyone. Sprint's Family Share Pack. Visit sprint.com/best value to learn more. Floyd Hillman, WSB.
I'm Channel 2 Action News meteorologist Brad Nitz with Atlanta's most accurate and dependable weather forecast. Periods of showers and thunderstorms continue right on through the day. Your best chances come through the afternoon and evening. The rain chance at 80%. Some of the storms could be strong to even an isolated severe storm possible. High today, 85 degrees. Drier with sunshine on Sunday. Looking at a morning low of 65, high 85 with low humidity.
72 degrees now
Okay.
on Eastern Street in Midtown Atlanta. Line of storm seems to be moving easterly out of the metro Atlanta area.
Easterly?
Still look severe as they move their way through Gwinnett, Walton, and Newton counties. I'm Veronica Waters with news on the hour, the half and when it breaks on Atlanta's exclusive 24-hour news, weather, and traffic station. News 95.5 at AM 750 WSB. Depend on it.
This is where that's a chance. After this.
Wrong open, my bad.
This is Atlanta. The wine, the entertainment, the lifestyle. This is Belinda Skelton's Atlanta Living, sponsored by Granite Transformations. Done in a day, beautiful for life.
My, how time flies when you're having fun. I'm here with my buddy, Dr. Paul Cox with Oculus. And if you want to look him up, myperfectage.com, and he's easy on the eyes, so go ahead and do that.
Thank you.
We are talking about hormones, male and female. And so I've been giving out the phone number. We've got to go straight to the calls because I'm going to make you work just a little bit. Tanya in Locust Grove. Tanya, you're on WSB. How are you today, sweetheart? How can we help you? Yeah.
I think that's a great idea, Tanya. The problem with over-the-counters is there's no regulation of that industry. If it was actually containing any strength of hormone that could be beneficial for you, it couldn't be sold legally over the counter. So basically what you're doing, I applaud you for trying, it's just not going to work.
Tanya, whether you're going to see Dr. Cox or someone else, I wholeheartedly agree. Those hot flashes in the middle of the night are nothing to laugh about.
Mm-hmm. That could be part of it. I would say go ahead and get this this little issue out of the way. But definitely, you should really think seriously about getting your hormones balanced. You won't believe the difference in how you feel. It will be amazing for you.
You may like your husband again. You may. Okay.
Great. Good luck.
Thank you, Tanya.
Thanks
for your call. And it does affect everything, like we've said.
Yep.
Okay. Gail in McDonough. Gail, you're on WSB. How are you today? Good. Bud, what can we help you with, sweetie?
Yes.
Ooh.
Okay. That's a great question. Basically, osteoporosis, of course, is when bone reabsorption and bone building gets dysregulated. And it's very common after menopause to have that because you lose your estrogen and you lose your testosterone, which are two of the most powerful bone builders that we have. So, with a history of blood clots, a lot of times we tell women that estrogen is off the table because estrogen in its oral form, which is the most common way to take it, does indeed increase your risk of blood clots. Estrogen done transdermally, either through a patch or through something that you rub on your body, or even as an implant that goes underneath the skin, doesn't really increase blood clot risk as markedly as the estrogen that's done orally. So sometimes we have women with a history of blood clot, depending upon their own personal medical history, who may choose to do estrogen that way. Even if you don't choose to do estrogen, I would highly advise that you look into doing testosterone. Testosterone is also another powerful builder of bone. It does not affect blood clotting at all. And the level of testosterone supplementation that we use for women is not going to make you grow hair. It's not going to give you big muscles or make you go bald. Okay? But what it can do is really help your bone density. And I'll tell you that studies have shown, and you can look for the evidence, but studies have shown there is no better builder of power of bone than hormones. The drugs that are sold increase bone density, but they don't decrease fracture risk. The only thing that decreases fracture risk is indeed hormones. Yes. No. Sure. You need to go to, I'm sorry, dear, you need to go to an integrative medicine doctor, okay? If you go to your primary care practitioner, they're going to look at you like you're crazy because they don't know anything about testosterone for women. Integrative medical physician or a functional medicine physician. These are new types of medicine. It's the type of medicine I practice. It's where we are taking primary care to the next level by adding services where we've done extensive education after medical school in things like hormones, in things like vitamins, in supplementation. Our job is to keep you healthy and happy and optimized rather than treating illnesses as they come along. So we have a completely different approach to medicine. It can. Yes. Check out my website. There's a lot of great information on there, and hopefully that will be good for you. Thank you for calling.
Thank you, Gail. Bye-bye. And once you get, and it's a teeter-totter.
Yes.
Once you get your hormones, I mean, you kind of have to work with them just a little bit to get them
Right.
all where they need to be.
That's true.
So it's not a one-time fix. So you will be working with your doctor hand in hand to get these things under control. Let's speak with Lisa in Calhoun. Miss Lisa, you're on WSB. How can we help you today? Sure.
Mm-hmm.
Yeah. Yeah. Yeah.
Right. Well, I'll tell you a little story real quickly about a patient that I met about a year and a half ago. When I met him, he was referred to me from a psychologist. They were treating him with antidepressants for depression. He rarely got out of bed most days, didn't eat very much, got to the point where he was so weak he could physically barely get out of bed. Myself treating him with the psychologist, we put him on testosterone and a few other hormones. His wife, of course, was extremely supportive. And in less than a year, that gentleman now has made a remarkable recovery. He gets up every morning before 9. He walks 3 miles a day with his wife. He's doing things around the house. He is mentally sharp. Now, and that's not to say that testosterone did all of that. However, we know that testosterone declines 1 to 2% a year in healthy people as they age past their mid-20s. So I would definitely say, especially if he's tired, if he doesn't have energy, if he's depressed, get his testosterone level checked, see what it is. But remember that normal for his age isn't optimal. There's a difference between normal and optimal. And someone like him, you want to optimize those levels. You want to give him the best chance he has of making a full recovery and having a full life. Well, that was thyroid. What we need to do for testosterone is, it's okay. He needs to have a testosterone level drawn first thing in the morning around 8:30, and it needs to be a free and a total testosterone. Okay, because the highest levels occur naturally first thing in the morning, so that's when we want to get him. We want to see what's the best that he can do, and then move on from there. I think so, yes. Thank you for calling.
You're a good daughter, Lisa. Thank you, sweetheart. Okay, let's see if we can squeeze just one more in. I always hate trying to choose the last one. Okay. Jolie and Snellville, you're on WSB. How are you today? Yes, how can we help you? Mm-hmm.
See another physician. Low normal's not optimal, Jolie, and that's the problem. Is we're treating numbers, we're not treating patients. If you have symptoms of hypothyroidism, if you have thin hair, if you have low energy, if you're gaining weight, if your thinking has been slowed, if you're depressed, all those things are classical symptoms of hypo or low thyroid hormone. If you have those symptoms and your thyroid is low normal, it's not optimal. You should get treated. You're welcome.
All right, look at that. She was easy peasy. And folks, if you want more information, it truly can make a difference in your life.
Yes.
And it's worth making an appointment. If it's with Dr. Cox, wonderful. If not, find another integrative physician in your area. Dr. Cox is myperfectage.com. And he's out of the Oculus building. Y'all call it, you're off of, what's the?
Oh, we're on Peachtree Dunwoody Road at Peachtree. It's Peachtree Dunwoody Medical Center. And I share an office with 2 facial plastic surgeons. It's called Oculus Skincare and Longevity.
Okay. And or you can look him up again at myperfectage.com.
Yes.
So thank you so much for joining us in the studio.
Thanks for having me. Every time that I get to come on with you, Belinda, we get such a great response, and I'm so grateful to you. I love your audience. They're fantastic. They ask great questions, and I just love being here.
I'm going to tear up. Okay, coming up next is going to be Breaking Choose with David Danzig. Stay tuned.
How was that?
Another